Lysodren, also known as mitotane, is a medication used to treat cancer of the adrenal glands. It works by slowing the growth of or killing adrenal gland cells and also decreases the amount of hormones made by the adrenal gland. The daily dosage and optimal timing for taking Lysodren should be determined by a healthcare professional based on individual medical needs. Take Lysodren by mouth with or without food as directed by your doctor, usually 3 or 4 times daily. The dosage is based on your medical condition and response to treatment. Using Lysodren regularly will help you get the most benefit from it. Try to take it at the same times each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster, and it may increase your risk of serious side effects. Make sure to learn how to safely handle and dispose of this medication and its container. It's important to note that Lysodren can be absorbed through the skin and lungs, and it may harm an unborn baby. Therefore, pregnant women or those who may become pregnant should not handle this medication or breathe the dust from the tablets. Some common side effects of Lysodren include dizziness, drowsiness, nausea, vomiting, diarrhea, loss of appetite, and weakness. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, it is advised to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it is important to tell your doctor right away if you experience any serious side effects, such as unusual or rapid weight loss, mental or mood changes, vision changes, change in skin color, fainting, easy bleeding or bruising, bloody urine, or signs of an ovarian cyst. Lysodren can commonly cause a rash, which is usually not serious. However, it's important to seek medical help immediately if you develop any rash. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Mitotane, also known as Lysodren, may make it harder for your body to handle physical stress. It's important to inform your doctor or dentist if you are using this medication before any surgery, emergency treatment, or if you experience a serious illness or injury. Your doctor may need to temporarily stop this medication and prescribe a different medication, corticosteroid, during these times. As always, follow your doctor's instructions carefully and communicate any concerns or changes in your health. Before taking Lysodren, make sure to tell your doctor or pharmacist if you are allergic to it or if you have any other allergies. It's important to discuss any inactive ingredients that may cause allergic reactions or other problems. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have liver disease. This medication may cause dizziness or drowsiness, and consuming alcohol or marijuana, cannabis, can intensify these effects. It is recommended to avoid driving, operating machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is advised. If you have a surgery scheduled, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that Lysodren can be absorbed through the skin and lungs, and may harm an unborn baby. Women who are pregnant or may become pregnant should not handle this medication or breathe in the dust from the tablets. If you are pregnant or planning to become pregnant, discuss reliable forms of non-hormonal birth control with your doctor while using this medication and for some time after the last dose. Your doctor will conduct blood tests to determine when it is safe to stop using birth control. If you become pregnant, it's crucial to speak with your doctor right away about the risks and benefits of this medication. This medication can also pass into breast milk and may harm a nursing infant. Breastfeeding is not recommended while using Lysodren and for some time after stopping the medication. Consult your doctor before making any decisions about breastfeeding while using this drug. When taking Lysodren, it's important to be aware of potential drug interactions. This medication can speed up the removal of other medications from your body, which may affect how they work. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some drugs that may be affected include cobicistat, doravirine, isavuconazonium, lurasidone, naldehyde, nifedipine, ranolazine, tamoxifen, voriconazole, and certain products used to treat hepatitis C. It's also important to note that Lysodren may decrease the effectiveness of hormonal birth control, such as pills, patch, or ring, which could potentially lead to pregnancy. It's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods while using this medication and to report any new spotting or breakthrough bleeding. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If someone has taken too much Lysodren and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to seek help right away in case of an overdose. Remember, you should not share Lysodren with others. It's important to have regular lab and medical tests, like checking your cortisol levels, liver function, and mitotane blood levels, while you are taking this medication. Make sure to keep all medical and lab appointments, and consult your doctor for more details. It's also important to take the medication exactly as prescribed, and to follow your doctor's instructions carefully. If you forget to take your dose, take it when you remember. If it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It is important to store Lysodren at room temperature, away from light and moisture. Keep this medication out of reach of children and pets. Do not dispose of Lysodren by flushing it down the toilet or pouring it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.